When I started medical school, the whole world is your oyster and you can choose anything you want to do. I think what drew me to endocrinology was that the disease conditions are just intellectually very stimulating and interesting to me. And then I think the second component is just the nature of the practice of endocrinology. It's in some ways similar to primary care, where I treat and follow patients for many years. So I'm able to build long-term relationships with patients and their families, get to know them, their children, etc. So I enjoy that component of it as well. I'm Dr. Xin He. I'm an endocrinologist by training. I help patients diagnose, manage, and treat their various endocrine conditions. That includes diabetes, thyroid, osteoporosis, adrenal and pituitary conditions. In addition, I'm also the director of the endocrinology program, and in that part of my role, I help make sure that my colleagues, our nurse practitioners, our nurses, diabetes educators are able to provide the best care to our patients as well. What I find most rewarding about my work is, I think for all doctors and healthcare providers to be able to help patients diagnose their conditions, to help them understand what it is that they have, to help them treat and manage, and help them feel reassured. Then I try to understand, each patient has different types of goals for their own healthcare. And so, I want to take the time to understand what their goals are, and that way I can provide a treatment plan that aligns with what they want and helps them achieve those targets. Outside of work, I like to spend time with my family, my friends. I come from this area, and I also enjoy painting and making art. I sometimes connect with my patients that also paint or crochet, and I enjoy swimming. That's sort of my primary form of exercise. Try to, practice a little bit of what I preach, and I also enjoy singing in my free time. What struck me when I interviewed here was the strong focus on patient safety and lean culture and open communication amongst different levels of medical practitioners. And also, being an immigrant myself, I think I was also drawn to serving this local population where there are a lot of immigrants and non-English speakers, and I think it's also extra rewarding to help patients that might have more limited resources, and I can connect with them on that personal level, understand the challenges that they've gone through moving into this country and now having a new health condition. The best moments are when patients say to me, "Thanks so much for taking the time to explain that to me, and I feel so much better now that I understand what's going on."